My name is Vincent Pompili. I did my medical school training at Case Western Reserve University in Cleveland, Ohio, my residency in internal medicine at the Johns Hopkins Hospital in Baltimore, my cardiovascular training at the University of Michigan, and my interventional cardiology training at the Mayo Clinic in Rochester, Minnesota. Even from an early time, I loved science, and I loved both scientific questions and laboratory data, even research through college. But the opportunity to integrate that in medicine and taking care of patients and patient relationships became very important to me. I specifically got excited about interventional cardiology because of the opportunity to be in a procedure-based specialty. The privilege in interventional cardiology is to take care of patients when they're very sick and then usher them through the care during massive heart attacks or cardiogenic shock, and then also the privilege to care for them when they get well and for many years to come afterwards. Common conditions and diseases I treat as an interventional cardiologist lie around the area of coronary artery disease. Specifically, as an interventional cardiologist, also specializing in structural heart disease, I also work in the new area of transcatheter aortic valve replacement. So patients who are having massive heart attacks, angina, placement of intercoronary stents, diagnostic catheterization to diagnose the disease of coronary disease. I also am involved with areas of aortic stenosis and implantation of prosthetic valves through catheter means. When I first meet a patient, I feel that it's important, before we even get down to the details of the medical questions or details about learning about their medical conditions, is really to establish a relationship. Even on the busiest days in my clinics or in the hospital, I think it is very important, both for myself and for that patient, to establish some level of relationship. Getting for a patient to know and to trust me as a person and vice versa is quite important. And it might just take a moment or two to sort of just get to understand a little bit more about that patient or his family or his profession or what his anxiety or her anxiety levels are before we go into the details of the medical needs. Working in an academic center is an exciting opportunity for me, and it's been part of my career for the past 25 years. Academic medicine allows us and challenges us always to be the best, because not only are we caring for patients on a regular basis, but we're educating the next generation of physicians. We always have to be on our top of our game. On top of that, both from a research perspective, we're asked to be involved, and I am involved in a number of clinical trials, which really allows us to provide cutting-edge research and new therapies to patients.